just simply means sudden cessation of blood flow to a part of the brain. And that can be due to two things. If the heart is pumping blood, two things can only happen. It's either the blood vessels carrying blood to the particular part of the brain is blocked, or the blood vessel has ruptured.
At the acute stroke unit of the Lagos University Teaching Hospital, LUTH, Idi-Araba, an average of 2 to 3 cases of stroke are recorded on a daily basis. These figures multiplied on an annual basis, you will agree that indeed there is a serious problem on ground.
Upon establishment of this stroke unit, for instance, by the management, by the LUTH management, by Professor Bode, was one of his initiatives. We have discovered that our patients who had stroke or who will have stroke have a better chance of survival. 14.5 million people will have a stroke annually. About 5.5 million people will die from that stroke. The message is, don't be that one person. Be among the 3 that will not have a stroke.
The stress in the society, increasing stress levels, meets up with their financial needs, has contrived with some other illnesses that may be ongoing in them to account for these high incidence. The final common pathway is usually a raise in the blood pressure of the individual, or what we call hypertension.
The major risk factors for stroke are high blood pressure, uncontrolled diabetes, overweight, and family history.
Stroke is not a death sentence, and you should know that it's preventable as well as treatable, Eat healthy foods, eat lots of vegetables and fruits and all the good diets. Then the people with hypertension should use their drugs, All those things are very important because you should know your numbers. If you know the numbers, you'll be able to know this, my blood pressure is going high and all of that, And when you see signs that feels quite abnormal, then such individuals should come to the hospital.
Know what your cholesterol levels are. Know what your blood sugar is. Know what your weight is. Weight reduction and lifestyle modification is absolutely necessary. It is advocated that people should do outdoor exercises, aerobic exercises of about 30 minutes per day, at least 5 times a week.
It's also important we talk about what to do immediately you notice a member of your family suffers stroke. Because the best results, in fact sometimes complete recovery, are obtained if the patient is taken to a good hospital, the nearest good hospital on time. If they can get there within 4 minutes and the right steps are taken and get adequate assessment and immediate treatment, which will include giving the person oxygen intranasally or by face mask, trying to bring down the blood pressure if it is too high. But if it's not too high, it's better to just leave the blood pressure alone. Then, of course, if the facilities are available to do a CT scan of the brain, then a firm diagnosis can be made as to which type of stroke this is. Is it because of bleeding in the brain, or is it because of blockage of some of the vessels in the brain? If it's a blockage of vessels, there are drugs that can be given immediately to try and unblock those vessels. And if it's because of bleeding, then we don't give such drugs until the bleeding subsides. And if it is blockage, again, in some advanced centers where neurovascular surgeries can be done, we can quickly do some surgery in the brain to remove the block from the vessels and reconnect them, and the person will have almost complete recovery. These are possibilities within the medical world now.
One of the ways you can recognize that somebody has a stroke is, one, the face. If the face is bent to one side, it can be as a result of stroke. So we have a mnemonic called FAST, or recently we say be fast. Be fast or fast. Be fast means that if the person having a problem with balance, is he dizzy? Can he not walk very well? Is he wobbling and this thing happening suddenly? That's B, balance. E is the eyes. Can the person not see very well, just suddenly, just occurs that the person can't see? F means face. Is the person's face droopy or bent to one side suddenly? A is arms. Are the arms weak, or can he not lift part of his arm? And when I say arm, in this case, I will also extend it to the leg. Is it that the person can't lift one hand very well, or the hand is heavy, or is that leg, is also the leg heavy? Then speech. Is the person having difficulty with talking? Then if you see all of this, that's balance, eye, face, arm, and speech. This is time to act.
For people already living with stroke, the experts believe that access to improved health care and a replication of a stroke care unit in other public health institutions, as done at the Lagos University Teaching Hospital, LUTH, will help increase patients' chances of survival and reduce the burden.